Okay, so today's press is going to be very similar setup. The governor's going to speak. Then Director Parson is going to kind of give you a recap update on today's. Then we're going to kick it over to Director Richardson. He's going to give you an update on some of the different things that are going on in his department. And then Director Pugh is here today to speak a little bit of an update on hers. We've got Dr. Williams here for questions. And then the governor will close after that, and we'll open up for questions. So, anybody have any questions right now for me? Oh. We anticipate having another presser tomorrow at 3 o'clock as well, so we'll send out a media advisory this afternoon. Okay.
Okay.
Sorry, I thought that was one.
Oh, I was just making sure you can hear the sound. Okay.
Everybody ready?
First of all, I want to thank everybody for being here today at the briefing. I also want to get started. I just got off the phone just a few minutes ago with the President and Vice President, giving a little update on the national level of things that are occurring, some on the test kit supply chain that's coming through. It was a very positive conversation. We were on the line with most of the governors of the United States. A lot of good things happening on the federal level as far as trying to make the product available. So it's good to that. The other thing we did earlier today, we talked to the Missouri Hospital Association with all the hospitals around the state to have a good conversation with them of what their needs were and what their future looked like for what they was going to need to be able to perform the services they do. Earlier today, most of my senior staff, some of the senior staff was at SEMA, making sure that we were having a plan in place for distribution of products that were actually being shipped out today across the state of Missouri. Some of it was the PPE that we did today. Also, the plan in place is all the federal money. Now that we know somewhat what's in that bill, start to prepare the planning process of how we're going to spend those funds and how quickly we can get them and how quickly we can get those to the local levels. So let me start off just a couple of issues today that I'd like to address and provide some clarity on. I know there have been lots of questions about why, as governor, I haven't taken further restriction measures and why I haven't mandated that all businesses shut down. Making a decision like that is much easier said than done. And to be right honest about it, I don't think it is the right thing to do at this time. There is a lot more that goes into the decision than simply just telling businesses to close their doors. So to give everyone a better understanding, I'd like to explain my thought process as to why we have not taken that step just yet. As a small business owner myself, I have personally experienced the challenges that come with running a small business. I know what it's like to take the risk and build a business from the ground up. I know how hard it can be to make payroll, to make a profit, and provide for your family, and even when times are good, let alone when times like this. Not to mention all the employees that work for you to understand what it would be like for them when those businesses close. In society today, we always talk about rewarding risk. And the last thing we want is in our small business owners to not be able to reopen their doors because we mandated them to close prematurely. That being said, this is not a decision we are taking lightly. We are very sensitive to the fact that Missouri is very diverse, and every community across our state has different needs. We fully support our urban leaders in Kansas City, St. Louis, Springfield, and Columbia, and the decisions they have made. But it is important to understand the major differences between Missouri urban areas and our small rural communities. It is much harder to go into a rural community and start mandating businesses to shut down when they don't have the infrastructure, the resources, or the plan in place that an urban area does. However, I strongly encourage all small business owners to take measures to help fight the spread of COVID-19. Practice social distancing and small gatherings at all times. Many restaurants and bars now offering drive-through, pickup, and delivery options. I also want to be clear that we have been very active in our response efforts, especially these past few weeks. We have been in regular communications with local officials, emergency management, county commissioners, and mayors to make sure they are informed, prepared, and have a plan in place before we make a decision to shut anything down. We will continue doing everything we can to minimize the impact of COVID-19 on Missourians and their families, which includes supporting Missouri's small businesses and the communities that depend on them. Now, just to recap, there are several things that happened yesterday. As you're all aware, we had our first COVID-19 death yesterday in Boone County. Also yesterday, several actions were taken to help with the COVID-19 response efforts. I signed an executive order authorizing executive agencies to waive or suspend certain regulations and statutes that interfere with our COVID-19 response efforts. This executive order allows all agencies to request a waiver or suspension of the regulations in an expedited process to further help provide immediate health and safety relief. Along with the steps taken by state agents, the executive order also enables doctors to diagnose and treat patients more easily through telemedicine to avoid physical contact. Extends the hours of commercial drivers so they can operate on Missouri roadways in order to deliver essential supplies. Several waivers have already been approved, and I'll let the directors talk about some of these specifically. Yesterday, I also directed SEMA and the Department of Economic Development to seek assistance for Missouri businesses through the U.S. Small Business Association's Economic Injury Disaster Loan Program. Now for today's updates. As always, my administration has and will continue to work hard for Missourians. Our citizens depend on their state government, especially in times of need. We have to keep our prisons, veterans' homes, mental institutions operating. We have to preserve public safety. We have to ensure our citizens get the support and benefits they need. We have to help our employers and workers across the state weather this storm. And we have to continue to fight the spread of COVID-19. All 16 departments have been working for weeks to prepare for COVID-19. And our department leaders have been working together every day to adopt and implement their specific plans for this situation. That includes following the public health expert guidance on social distancing. We need to protect our workforce. Different departments have to work in different ways to deliver to our citizens. But the steps already taken include alternating shifts, schedules, job sharing, and increased telework. We have canceled large group training and conferences. Many departments are applying for waivers from the federal government so they can operate in new ways also. As we shift our position, our citizens should expect some delays or interruptions in normal services. We are also experiencing increased call volumes in some areas, and we hope our fellow citizens can understand why our operations have to adapt to the situation. We strongly encourage all citizens to follow public health guidance to avoid contact with groups, which is why we urge citizens to first try to assess the state government through department websites and then through call centers. They should do what they can to avoid coming in person to any office as much as possible. Citizens should continue to expect to see other changes in specific services as we adapt to the COVID-19 challenge. That said, the state government will continue to provide essential services for our citizens and do whatever possible to assist in the fighting of COVID-19. Some other updates from today. All public and charter schools in Missouri are temporarily closed. I commend all the administrators and teachers for their strong leadership, and I strongly recommend that for at least the next 2 weeks, that people should not gather in groups of more than 10 people. As far as COVID-19 information, we continue to encourage citizens to visit the DHSS website or call their 1-800 number. In regarding to testing, DHSS has secured a contract with Quest Diagnostics and will also be procuring them from the LabCorp and Vector companies. It's important to know on the testing process that you're going to see many more tests being conducted in the near future, and you're going to see more cases being positive. We will believe that there'll be thousands upon thousands of tests being done in the near future through the private sector and to the state level. And that expands our testing capability. And we know these commercial and private options will continue to expand for hospitals as well. Because of this expanded capacity, we will also be expanding testing criteria in the near future. This will allow Missouri testing capacity to continue to expand. We are utilizing all sorts of resources at our disposal. For example, through the Department of Corrections, the MVE is going to start producing hand sanitizer. OA was able to produce the raw materials and will be able to produce more than 2,400 gallons of hand sanitizer every 2 days. This could continue to be very helpful as we monitor our supply chains. We will continue using all the tools we have available to provide solutions and protect the health and safety of Missourians during this time. I would like now for my directors to give you an update on their departments and the things that are going on. And I'm going to start with Director Parson of Public Safety. Sandy.
Thank you, Governor. And he kind of touched on it. I want to talk about personal protective equipment. About 2.5 hours ago, the State Emergency Management Agency warehouse took delivery of several pallets of personal protective equipment that will be added to the Strategic National Stockpile. This afternoon, employees and team members are working together to sort that out to meet the requests that we've received thus far from hospitals and emergency management service agencies throughout the state. So far, 44 EMS agencies and 27 hospitals have requested equipment from the Strategic National Stockpile. We have received many requests from law enforcement and fire, and that supply of personal protective equipment will be provided next week as soon as we receive it. We will work through those requests. Also today, we are working with our communities across the state, different hospitals and providers, to set up mobile testing sites. There are 14 currently operating that are private mobile testing sites, and one is in the works at the State Fairgrounds in Sedalia, Missouri. We anticipate that being available for testing on Saturday. As more come online, we will make sure and provide that to the public. We'll make sure and provide a map to all of you so that you can reference those sites. So with that, thank you.
Thank you, Sandy. Director Hugh from the Department of Labor.
Good afternoon. My name is Anna Hugh from the Department of Labor and Industrial Relations, and we oversee the unemployment insurance program for the state. We want you all to know that the investments we've made to modernize our unemployment insurance system has helped to prepare us for any type of economic downturn, and currently the one that is being caused by this public health crisis. And so we are fully operational, and we can basically have individuals file claims 24/7 on our website, and that is labor.mo.gov. We do have a slider on there where you can click first-time filers. We know in times of very low unemployment insurance, we have a lot of people who are interacting with the unemployment insurance system for the first time. So we do have videos on there, one that talks about how to file for unemployment insurance, and then there's another video that actually walks through step-by-step how to actually get registered with the system and then actually file the claim with the system. In addition, for businesses, this is a time for us to really talk through and help you all think about what your options are. If you need to continue some level of operation, we would suggest you contact us and take a look on the website about the shared work program. Let me explain. So the shared work program allows for any sort of decrease in volume of work to be spread out across your workforce. And so basically, you know, it can be impacting as few as 3 employees in your organization, but as long as you are up to date with your contributions, so your payroll taxes to the unemployment insurance system, as well as your quarterly filings, you're able to participate in this program by indicating that you have a production decrease of potentially between 20 to 40% of what your available work would be. You can spread that across your workforce, and so for the hours that they actually work, then they are paid at their regular rate. For the hours that they're no longer working, they will then be able to collect unemployment insurance for that day. This program in particular helps to lower the immediate impact on the unemployment insurance trust fund. It also allows for employees to be paid at a higher rate. In addition, employers do agree to provide full benefits as they are provided to those employees during their regular times. So workers will also get the benefit of having medical or healthcare benefits that are provided by the employer. And the employer also has the ability to maintain that skilled workforce. This is a program that can run over 52 weeks, and you can ramp up and ramp down with those employees at any point. So this will help in our recovery effort too, to really talk about what are our immediate needs to address and respond to the current public health situation, and as we are getting to a point when it will be more normal in terms of the public health crisis, what can we do to then begin to bring additional folks back on for more hours. So again, that program is called Shared Work, SHARDWORK, and you can find it at sharedwork.mo.gov. So with that, I'll turn it back to the governor.
Thank you, Director Hugh. Director Todd Richardson, you want to come up? I know Todd's been working, him and his staff, on some of the new legislation that come down from the federal level. We're still trying to analyze that bill that was passed, trying to figure out how it's going to affect us in Missouri. But I want to give Todd the opportunity to give you a quick update, but keep in mind, they're still going through this process as we do this. So, Todd?
Thank you, Governor. And I want to say I think there's been unprecedented collaboration across state government to help deal with an unprecedented event, and that includes unprecedented collaboration with our partners in the healthcare delivery system that are going to be significantly impacted by this event. I wanted to give you an update on some of the things that have been done both at the Department of Social Services and at our sister agencies at DMH and DHSS. The state, as I mentioned before, has now removed all restrictions on telehealth, and we have sent guidance to providers to that effect. We are executing with our federal partners emergency state plan amendments and waivers to ensure that no Medicaid participants are owing a copay for telehealth services or testing. In addition, tomorrow we will be asking the federal government for what is called an 1135 waiver that will streamline some of the requirements on providers being able to provide services in our state. That includes changes and flexibility to prior authorization requirements, to fair hearings, to enrollment, licensure, and revalidation of providers, as well as removing restrictions as necessary on the number of beds and length of stays that can happen in a critical access hospital. It will also give our providers the flexibility to provide care in alternative settings. In addition, the Department of Social Services, consistent with the Families First Coronavirus Act passed by Congress yesterday, will not terminate eligibility for any Medicaid participant unless the individual requests a voluntary termination or ceases to be a resident of the state. Additionally, Missouri Health Net will be extending 90 days of coverage to Missourians aged 19 to 64 who meet the income and resource requirements of the current program and test positive for coronavirus 19. We have already begun to relax the requirements on providers related to prescription refills and to ensure that every Medicaid provider that is seeking enrollment quickly gets through that system.
Thank you, Director. Director, that are up here, I tell you, directors we sent out several days ago that they know very well, and I want that they are on call 7 days a week, 24 hours a day with their senior staff. And I can't say enough for the directors in the state of Missouri how they have come together to help fight the COVID-19 and putting all our resources towards that and be able to focus on that. And it's been incredible what they've done. So I want to thank my directors for all the work they're doing. Dr. Williams is here. I'm not going to bring him up to the podium. Me and him's traveled all over the state for several days talking, but he's here for a question, so I don't want anybody to read anything into that. I want you to understand why that is. So we're going to open it up for questions. Kelly?
Governor, can you clarify the situation with schools? Was that a decision you made, or with all the schools in the state on their own decided?
All the schools in the state on their own closed.
Can you talk about why you didn't tell them?
Because I think earlier what I said, they're so diverse in the state of Missouri, I think every school has to be able to plan for that day when that comes. If you go to rural Missouri, for example, there's no daycare services there. So when you shut down a school down there, that creates problems itself. Plus there's a workforce out there. Those school districts sometimes will be the largest employers. And frankly, I could make a couple of schools close by. Eldon I'll use for an example. There's a lot of kids over there probably don't have no place to go. And so you have to consider what that's like all across the state when I did that. And I supported the superintendents. I supported the decisions they'd make on the local levels. But I firmly believe that's where that decision should have came from.
Governor, that House passed a plan yesterday that would include $33 million in federal funding. During all of that talk, Representative Kathy Swan talked about how there was a picture being painted about this doomsday scenario. So I'd like to get your comment on, is $33 million enough, and what's your response to her view?
Yeah, I don't think there is a doomsday for the state of Missouri or the United States or over the COVID-19. I said yesterday, I think it's something we all have to be concerned with. But to try to put that into a fear category is wrong. This is not something. This is like viruses we've dealt with before. It's going to take us some time to be able to treat that virus, to come up with a vaccine at some point. But if people will follow simple instructions, they can sure slow the process down of the COVID-19. We all know that. So do I think it's doomsday? By no means is it doomsday. Is people going to come up and test positive? Yes. Will some people die? Yes, probably so. But the point of it is we can conquer this. We can get through this. It's not going to be a week or two process. I do believe for the short-term outlooks, it's maybe 2 to 3 months. So people have to understand that this is going to be a process. But I think we got some of the best medical professions in the world here in the United States. And I'll almost say that here in Missouri. When you look at what universities we have, what specialties, what medical facilities we have, there's none better to be in this state. And I think with the responsibility they have and what they're doing right now is incredible. I think what you're going to see to provide testing for people, to give them a little more comfort in that. But doomsday, no. On the money side of it, we're going to all have to rethink the budget process this year of where we are financially. Look, this is a lot more than COVID-19. This is thousands of people losing their jobs. This is businesses closing down. There's a lot of things going to be at stake. So for me, as governor, I want it to be about as wide open as we can make it to deal with COVID-19. And I'll be meeting with the leaders of the House and the Senate to have that discussion in the near future.
Is there a plan to either expedite unemployment benefits or extend them past, I think we're at 13 week kind of cap? Are there talks about that? And could it be done by yourself without the legislature?
Yeah, I think those are all conversations. We're going to be talking to leadership this afternoon with the House and the Senate. Those are all things we're going to be talking about and trying to put that plan in place. I think today when I said we were out at SEMA, it was that plan in place. Actually, Kurt, where we're going to be putting those to see what we can do and what we can't do and really be able to put that out. So again, I think that's why we're doing the daily briefings, to try to get you that information as soon as you can. But look, we are in almost uncharted waters here of where we're going. So I think we're going to pull everything we can together to make sure we're taking care of Missourians. That's the number one priority. And I think every one of these directors, we're meeting daily trying to dispose of regulations, of policy, of bureaucracy for everyday people. So, but we realize that's going to be a big issue. And we're going to try to help people out there as long as we can. And maybe some other alternative thinking outside the box that we've never done before.
Governor, are you considering moving back the tax deadlines in the state?
I didn't hear the last part of that.
The tax deadline in the state, are you thinking of changing that?
Yeah, I think we're looking at all that's on the table right now. I think, you know, what the federals did, but I don't want to say that concrete, but we're looking at all those.
What are some examples of waivers that have been requested? I know the Health Net Director gave some, but are there others that...
Well, I think just what Director Richardson just talked was a whole line of them, of what we're being able to do, and those are going to continue to grow. You know, when we did the executive order pretty well opens up a lot of things and a lot of process we can do. It is broad, and I'll be the first to admit that for a governor. Most governors wouldn't put that out there, but I think right now we got to have everybody on the table. I think the federal money coming in, how we're going to be able to utilize that, how we're going to be able to get to that. I can tell you one that I've got a letter that I'm getting ready to send to the president, you know, about the utilization of our Guard here in the state of Missouri, how I can utilize that more without going through the federal guidelines to put that under the governor's control. I think there's things like that we're doing every day, but you're going to see I think a wave of different policies of the regulatory environment that we're going to be looking for waivers for. There's going to be a lot of them, so we'll try to keep you updated on that daily as we go through that. And at some point, we'll probably just release, hey, here's all the waivers we've done.
Is there an update on the numbers of cases here in the state? I know yesterday it was 24. Is that still the same?
Yeah, Dr. Williams, what is the update? Go ahead and give them an update on that.
Thank you for asking. We did 62 tests today that came off a little early. We've had 4 new positives. We were in the process of notifying those local health departments so that they can notify. That should be, we're updating every day at 9 a.m. and 9 p.m. We changed it 1 hour to give the locals some more time. So I would suspect that by 9 o'clock tonight, that will be on our website where those are. Yes, 28 total cases. And as we've talked about, we're not going to constantly update you on the number of cases, labs we're doing, because now I've been in contact today with numerous commercial labs and university labs that are doing lots of tests. So really the number going forward that will be pertinent is just the number of positives.
Hey, Dr. Williams, I'm
Yes.
aware if there are any public or private sites within Missouri that are helping in the development of the pharmaceuticals or treatments for this virus.
It's my belief WashU is. I may be wrong on that, but I believe they are. And again, just you want to reiterate what Director Parson said. We have 14 mobile sites in Missouri now, which we're incredibly appreciative of. And I've talked to several of them today. They did 100 tests in Springfield yesterday. They did 100 at Mercy, I believe, yesterday. Charlie Shields, I believe, and Truman, I believe they're one of the ones too. So, you know, we have talked about pushing forward to getting into surveillance. and our private partners have done a great job of that with 14 sites already up, and then ours will be joining them shortly. Thank you.
We'll take one more question, I think, Governor, you can close it with your closing remarks. All right, last question?
Governor Parson, have you given any consideration to closing state offices? What guidance have they worked?
No, I think what I said earlier, we're trying to make sure we're keeping people out of small groups. We're trying to make sure people can work at home and can work at home. We're doing alternative shifts, bringing people in the weekend. But look, state government's got to keep going. There is no options to that. We have to be here to deliver the services to the people of the state. I say this the front line where we're at today, and it's just as important for me, the governor, to be here every day. To be at a time of leadership, you have to be here to lead, and I don't think you can do that at home. So we're going to continue to do that. We'll be looking at all categories. If we can get people home, we'll get them home, if we can. We'll also be looking at other resources. If we maybe shut down, for example, well, that's the state parks. That frees up people we might be able to use somewhere else for other positions in the state right now, because we know the demand is going to continue to increase here in the state on that. So I know I've said it, and I'm going to say it again, and I'm going to say it every day. Every day we are constantly receiving updates and new information. We will continue to be transparent and share new developments with the public as quickly as we can. However, I want to point out that this is not the time to tear each other down. This is a time we should all be working together, no matter where you live, no matter where you're from. This is the time when we all support each other, when we show what Missourians are all about, when we say what the Show Me State's all about. It's about all of us working together to help fight this. And frankly, to protect people's lives is what we're all in here today for. And that's exactly at the end of the day why teamwork is so important to me right now. Why it's to having the right people in the right places in state government. It's why people's willing to do that, to step forward to do that. I want to especially thank our medical professionals and first responders for working so hard around the clock and going above and beyond to help our fellow Missourians. The situation that happened in Boone County yesterday worked like it should have worked. People were warned that we had a patient with COVID-19. Emergency personnel had the ability to get protection gear on to go to that person and do that. Those things are all important. It's important when we talk about supplies that we get that, because there's days like yesterday that makes a world of difference. Makes a difference between somebody else getting sick or somebody else dying. Those are the reality of what we do in here. At the end of the day, we got to do our part. We got to realize in the state of Missouri, right now we are focused on COVID-19, but I also have to focus on the flooding situations that are starting in northern Missouri as I speak in front of you today. Thank goodness we have good leadership in this state, and we were prepared for that. We knew the possibilities of what was going to happen in flooding, and we're here to be able to do that. Those are the things that's going to rapidly change every day. Our decisions are going to change every day, and it's just why we're going to do these daily briefings out here. And it's important when we do give that information, as I told you yesterday, for all of you, to make sure we get that information to the public. Because as I said yesterday, fear is not where we want to be. We want to be concerned, we want to be in control as much as we can control ourselves and where we go tomorrow. That is really what's important, and that's where we go. Again, I want to thank you all for being here today. Thanks for that. We'll keep you updated on the briefings. We're going to be working through the weekend this weekend, so we'll be keeping you updated on the briefings. Thank you very much.